almost 8 years now. I started my career in labor and delivery. And then I have moved to the non-hospital world, where I have specialized only in GYN care. So I do have some experience in L&D, but for the last 5 years or so in GYN only care, which I'm very passionate about. A little bit about me: I'm from Alabama. You might hear my accent come out, maybe not. And then I live in the DC area. I've been here for about 8 years since I've been a PA. I'm really happy to be hosting this for you guys today. I'm open to any questions, so feel free to drop those. I'll try to answer them as we go, but if we don't get to any, I'll answer them at the end. If it's something that takes a little bit more effort, we might respond to you via email too. Again, we're really happy to have you here, and we'll get started. So today we're going to talk about fibroids and the connection with vitamin D. We'll talk about risk factors, symptoms, and types of fibroids. We'll discuss the role of vitamin D, evidence that's out there, recommendations for supplementations, and then we'll talk about other treatment options for fibroids as well. It's very important to know that up to 80% of women can suffer from fibroids. Now, that's a lot if you think about it, 80%. And that statistic is from up until the age of 50. So most women will experience fibroids. Some will have symptoms, some won't. Some will have an impact on their daily living from the fibroids, and some won't. So it just depends on the type and size of fibroids. We'll get into that more. Women of African ancestry are 2 times more likely to get fibroids than Caucasian women. But we also know that Native American, Asian, and Hispanic women can suffer from fibroids. Unfortunately, there's not a lot of research to give us a good idea of what the prevalence of fibroids in those other populations are. A fun fact is that, I guess it's not fun, but a fact is that women were actually not required to be involved in research studies until 1993. That's when the NIH said you have to include women. So prior to 1993, the majority of research studies were men. And obviously, men don't get fibroids. So fibroids weren't studied that often. So what are fibroids? So very simply, fibroids are growths or tumor growths, typically smooth muscle. Typically, they are benign. They're not cancerous, and they can be a variety of sizes, and they can be located in a variety of locations in the uterus. We typically describe fibroids by where they are in the uterus. We have intramural fibroids. These are involved in the muscle of the uterus. We have subserosal fibroids. These are just below the serosa of the uterus. We have submucosal fibroids, which are in the muscle, and they can also be involved in the cavity, so either abutting the uterine cavity or actually in the cavity. These tend to cause the most bleeding and issues with infertility. As you can see from the picture, if we have an embryo that we're trying to implant in the uterine cavity, if a fibroid is in the way, that could discourage the embryo from implanting, cause issues with the placenta growing, etc. We also have pedunculated fibroids. So these are typically attached to the uterus with a stalk, and these can be a variety of sizes. These fibroids get their blood supply from the uterus, but sometimes they can get the blood supply from other organs, like omentum or your intestines. So what are some symptoms of fibroids? There can be many symptoms. Some women have several symptoms, some women have one, and some women don't have any symptoms at all. Most common symptoms: excessive bleeding during your period or in between periods. Now, there can be other causes for that besides fibroids. So if you have heavy bleeding, it doesn't necessarily mean you have fibroids, but you would want to look into it more. Anemia is a big one. Oftentimes women who are bleeding so heavily that it causes their blood levels to drop really low, giving them anemia. Those women typically have some fibroid involvement, and sometimes it's involved in the cavity. There, again, other conditions can cause very heavy bleeding, like adenomyosis. You can have painful sex, pelvic pressure, frequent urination, rectal discomfort. So these 4 symptoms often are due to very large fibroids. So if you have a large fibroid that's putting pressure on your pelvic floor, which kind of holds everything up, that can be very uncomfortable. Some women have trouble finding clothing that fits because their belly protrudes differently than, women without that.
Emily, I think. Emily, I think your audio disconnected. Please bear with us. I think we're just experiencing technical issues. Are you able to hear? Hi, Emily.
I don't know, do we get cut off somehow?
Yeah.
Okay.
Can we? Okay. We can just jump right in.
Yeah, no problem. I'll hop back in. Give me just a second.
Please bear with us. Typically, the technology gods are with us.
Yeah, maybe not today.
Yeah.
Do you remember where I got cut off? And that way I don't miss anything.
It was right, your last, yes.
Last one.
Yeah.
Okay. Okay, so I'm just gonna start where I think I left off. But the short of it is fibroids, if they're big enough, can put pressure on our pelvis, causing pressure on our bladder, pressure on our rectum. Our rectum goes right behind our uterus. So if we have fibroids that are pushing on our rectum, we can have issues with bowel movements and constipation or discomfort when we're having bowel movements. Same thing for urinations. If we have a fibroid pushing our bladder, that can cause issues and symptoms related to urination. So how do we know if we have a fibroid? The best way is to see your GYN and ask for imaging. Imaging is our best tool that we have. Your GYN could also do a pelvic exam. I wouldn't say that is the most specific or accurate way, because we can only do so much with a pelvic exam. It can be uncomfortable for the patient as well. That's why an ultrasound, either on top of the belly and or inside the vagina as well, can give us a good idea of whether you have fibroids or not, what size they are, where they're located. An MRI can also tell us this as well. A CT scan, not as specific, but we'll see this ordered, if a patient goes to the ER. And hysteroscopy. This one I think is underutilized. So what a hysteroscopy is when we take a camera and look through the vagina, through the cervix, inside the uterine cavity, and we can see what the cavity looks like. And we can see if there's any fibroids, we say abutting or against the cavity wall, if there's any fibroids in the cavity, and we potentially could take them out. Now we do hear in our practice that a lot of women have issues getting their doctors to order imaging. So if you have those issues, ask your doctor, hey, can you at least order an ultrasound? I'm having these symptoms and I just want to make sure I don't have fibroids or something else is going on. Typically, they should order it for you. If they don't, never hesitate to get a second opinion or to find another doctor. I know that can be a little labor intensive to find another doctor, but your health is worth it. So definitely we encourage patients to get another opinion try to see a specialist, not just your typical OBGYN or someone who's mainly a baby doctor. You really want to find someone who specializes in GYN if you're not getting where you want to be with your current doctor. Of course, we specialize in this at the Center for OBGYN Care. So risk factors for fibroids, starting your period before the age of 10, obesity, eating a diet that's very high in processed foods. So what that means is people who don't eat a lot of vegetables, fruit, meats, they're eating a lot of packaged food, pre-made food. That's linked to fibroids. Drinking alcohol is another risk factor. There's actually a study where they looked at women who consume beer, and the women who consume more beer were at a higher risk of having fibroids. Family history, we do know that there's some genetic link with having fibroids. So if your mom or grandma had fibroids, there's a chance that you could have it too. No history of pregnancy, high blood pressure, use of soybean milk. So this one's interesting. Soy can actually mimic estrogen in our body. So if we consume a lot of soy, that can mimic estrogen, and estrogen plays a role in fibroid development. And low vitamin D, which is why we're all here today. So now I'm going to spend a couple of minutes talking about vitamin D. This will kind of be a little bit of a separate conversation from fibroids. I really want to focus on vitamin D, and then I'll bring it back together what vitamin D has to do with fibroids. As Beza mentioned, I'm very passionate about vitamin D, just because as a practitioner, I didn't learn a lot about it in school, and the more I've learned and the more research being done, the more that comes out at how important vitamin D is. It's a very cheap test to order. It's a very cheap supplement to take, and it's in my opinion, the low-hanging fruit. So some facts about vitamin D. 70% of Americans have suboptimal, insufficient, or deficient vitamin D. So over 1 billion people worldwide. That's a lot of people. I read a statistic as well that said 80% of women with fibroids have a vitamin D deficiency, that's a lot. So vitamin D acts in your body more like a hormone that does a typical vitamin. It's involved in over 1,000 different genes in their expression, which is very important. Vitamin D is fat soluble, which means that when you are taking a supplement or eating a food with vitamin D, you need a healthy fat with it for your body to absorb it. So healthy fats are things like butter, avocado oil, olive oil, coconut oil, avocado, nuts. Those are kind of your healthy fats. So if you're taking a vitamin D supplement, it's best to take it with a meal. You typically have fat with most meals, dairy and cheese or other fats that you would consume. Vitamin D plays a huge role in our immune system. I think this is really underemphasized in the medical field, and I think we kind of miss the bar on this. But that's why we're here today, to educate you and to educate people about the role of vitamin D. It regulates calcium and phosphorus levels, which I'll explain more later. Also magnesium too. So I'm going to spend a little bit of time talking about vitamin D's role in diseases, because I think that it's bigger than a lot of people would guess. So first, with the immune function and inflammation. So vitamin D actually helps to activate our T cells and B cells. These are involved, these are our white blood cells. White blood cells fight infection in diseases. So vitamin D helps to activate white blood cells fighting disease, which we want. It also plays a role in inflammation. Vitamin D helps with sex hormone production, fibroids, obviously, fertility. So there's an interesting study that looked at sperm health in vitamin D, where they gave men with low sperm motility, which means how well the sperm move. they gave them vitamin D and their sperm motility improved, which is really interesting. They also did a study in patients undergoing fertility treatment, specifically IUI, which is intrauterine insemination, where they looked at the uterine lining and they found that women with vitamin D supplementation had a healthier uterine lining, making it more likely that the embryo would implant, which is interesting. Vitamin D is also linked to premature ovarian failure. Now I'm going to pause there because I mentioned vitamin D is linked to, or I'll say vitamin D is correlated with, and I think it's important to realize that in many things in medicine, it's not always cause and effect, and it's not always black and white. We can't very clearly say, oh, because you're vitamin D deficiency, you're going to have fibroids, or because you have vitamin D deficiency, you're going to have low sperm motility. It's not black and white. It's not a cause and effect. Most of these studies are correlations, which just means, you know, women with fibroids tend to have a low vitamin D. And we see, you know, we track these trends to then investigate further. So more research is needed, but again, I'll continue to talk about some of the diseases because a lot of these things are correlated. So high blood pressure, fibromyalgia, autoimmune disease. There was a very interesting study in kids where if they gave kids at risk for developing type 1 diabetes vitamin D, they were 80% less likely to develop type 1 diabetes. So that's a big deal. Osteoporosis is bone loss. So we need vitamin D in our bones, and we also need calcium. So vitamin D helps calcium to get to our bones. Without vitamin D, calcium can't get there. We'll be at risk for osteoporosis. Dental health, bone health, your teeth have vitamin D and calcium in them. Cancer. So vitamin D has been shown to be anti-angiogenic. So what that means is it prevents the growth of new blood vessels. It's also has anti-tumor agents, so inhibits tumor growth. Both these things are very important in cancer treatment and cancer outcomes. So some interesting breast cancer studies I just want to touch on really quickly. There was actually a study where women who had breast cancer, and they were undergoing treatment, if their vitamin D level was greater than 20, they had a 27% lower risk of death. So meaning you have vitamin D, you have breast cancer, you give them vitamin D, and it lowers their risk of death from the breast cancer. So that's very interesting. Again, it's not a cause, it's a cause and effect, but it's a correlation, and it's something that I think is very important. Chronic muscle pain. We actually had a patient not long ago who came to us for endometriosis, but she also had chronic muscle pain all over her body, and she worked in an emergency room, and so that really impacted her work. Her vitamin D level was actually 7. We treated her vitamin D level, and her joint pain and muscle pain went away, which is really powerful. I think that's something that we miss sometimes. Brain health, vitamin D can be neuroprotective against Alzheimer's and Parkinson's. It's been studied in mood disorders like depression, seasonal affective disorder, postpartum depression. People with those issues, with postpartum depression, and seasonal affective disorder have more likely had low vitamin D versus people without those disorders. Hair loss, heart disease, COVID, flu. So just to touch on COVID quickly, there's a really interesting study from Israel where they looked at patients who had a vitamin D level greater than 50 did not develop severe COVID symptoms. which is really interesting because during that time, it was a very difficult time where a lot of people got really sick. But there's several studies that show having an adequate vitamin D level decrease your risk of having severe symptoms, decrease your risk of hospitalization, and if you did have those severe symptoms, it decreased your risk of having cardiac or heart damage or cardiac issues. So vitamin D plays a much bigger role in fibroids. We'll hop back to fibroids in just a second. But I just wanted to speak about that briefly because I think a lot of us suffer from these things or know someone that does. And it's a simple check that you can just say, hey, can you check my vitamin D? And any doctor can order it. So why are we all deficient? Mostly a lack of sunlight, lack of food sources. I read a study where most Americans spend 90% of their day in the OR, or I'm sorry, inside. And I would say that is definitely the case for me because I am in the clinic all day, or I am in the OR where there's no windows. So I don't get a lot of sunlight. Lack of vitamin D in food sources and depleted soils. You can have genetic changes that don't allow you to absorb vitamin D, or you metabolize it or break it down too quickly. Skin color can affect your vitamin D absorption. People who have higher melanin in their skin, although it's great because it blocks the UV, less likely to have skin cancer, it does also block UV, which we use to convert to vitamin D in our body. Obesity, this one's interesting. So vitamin D, as I mentioned, is fat soluble. It's stored in our fat tissues. If you have more fat on your body, you need higher vitamin D stores to fill that space. Very easy way to describe that. Some medications can decrease your vitamin D levels, especially steroids is a big one. Some antibiotics, some blood pressure medicine, also antacids. We need stomach acid to convert vitamin D. Without enough stomach acid, we can't absorb vitamin D. Gut issues, so people with Crohn's, ulcerative colitis, other diseases that causes gut inflammation, they also tend to be deficient in vitamin D. Okay, let's talk about optimal levels. So in order to know how much you need to take or if you're deficient or not, you have to test. The best test to order is a 25-hydroxy vitamin D3. Some doctors order vitamin D2. That doesn't really tell us much. So the D3 is key. It's typically a cheap test, typically covered by insurance. We test a lot of our patients who we think potentially could have a vitamin D deficiency, and we catch a lot of patients with vitamin D deficiencies. Let's talk about lab ranges. So I hear a lot, my doctor said my vitamin D was fine, it was 31. So how we get lab ranges or lab levels and what we say is normal or not is based off of an average. So the vitamin D range on a lab result is based off the average vitamin D levels of, the population that they took that from. So for instance, it's not always an optimal level, it's an average level. We know from research and studies that an optimal level is higher than what our average level is. So an optimal level is between 45 and 80. I typically like to see between 60 and 80. That would be the most optimal level to get. So if you have your doctor test you, you see your level, just check it. It should be between 45 to 80, 60 to 80 would be the most optimal range. If it's lower, that could mean you want to add in some supplementation. And if it's higher, that could also be an indication that you don't need supplementation. So I don't like to see levels over 100. The reason why is when we have levels over 100, we can have an increased risk for kidney stones. Now, if you see a level over 100, it's no reason to panic or freak out. You just come down on your supplementation and your level will come down. Typically, when I start patients on supplementation, I want to recheck their level in about 3 to 6 months. The reason why is everyone absorbs vitamin D differently. Some people need lower doses, some people need higher doses. A lot of that has to do with genetics and also the type of supplement. One thing that I wanted to just touch on about vitamin D levels and why I would check and continue to check throughout someone's lifetime is we're not just looking for acute issues with vitamin D, we're looking for long-term issues. There's something called the long-term latency effect. So we know acutely, if you have vitamin D, you can have rickets, which means soft bones. So that would be a vitamin D less than 10. And your bones can be soft, your muscles hurt. But long term, if your vitamin D level, let's say, hangs out in 2025 at the 2025 level, your bones might not hurt. But by the time you're reaching menopause, you might be at higher risk for developing things like osteoporosis. So by having a more optimal level at a younger age and continuing to have that throughout your lifetime, you reduce your long-term risk of things like osteoporosis. Also, different cancers and chronic diseases that we talked about briefly earlier. So how do we get more vitamin D? Natural sources, the sun. Again, I mentioned there's some issues with the sun. Most of us aren't outside all the time. If we are outside, we usually use sunscreen, which is great for preventing skin cancer, but not good for vitamin D absorption. And we also are covered in clothes. So most of us aren't running around in bikini close to the equator for a couple hours a day. So generally speaking, we don't get enough from the sun. Food is a great place where you can get vitamin D, but I will say most people I know don't eat the foods that are higher in vitamin D. So that would be sardines, tuna, beef liver, wild mushrooms, cod liver oil. Not typically in a person's diet. Egg yolks are, and I definitely encourage women to eat the whole egg, not just the egg whites. So if we can't get it naturally, where do we get it? And the easiest place is supplementation. Supplementation, there's different kinds and different forms. The best absorbed is vitamin D3. A lot of times we see D2 prescribed, and that can help your vitamin D deficiency, but vitamin D2 typically is not absorbed as well, so you need higher doses. It's also most ideal to take D3 with vitamin K2. Vitamin K2 helps D3 get absorbed in our gut. We, many years ago had a lot of K2 in our gut, and now we don't. So that's why I like pairing it vitamin D3 with K2. There's a question that asked, is vitamin D the same as D3? So it should specify on the bottle whether it's D2 or D3. It typically won't just say one. And if it says only vitamin D and it doesn't tell you D3 or D2, I wouldn't take that supplement because I wouldn't know what I was taking. It's also ideal to take it with magnesium. My favorite magnesium is magnesium glycinate. I would not take it with magnesium oxide or citrate because those can give you loose stools. So if you have constipation, that's great. But if not, my ideal is D3 with K2 and then magnesium glycinate. So a little bit more about supplement options. Obviously, the most economical would be for your provider to send a prescription to your pharmacy if your insurance will pay for it. Some will just say it's over the counter, buy it over the counter. It's a great option if you're on a budget, but a lot of times it's vitamin D2, so you might need higher doses. Also, pharmacies don't carry D3 with K2. So if you're taking a D2, I would also buy K2 to take with it. So that gets a little convoluted. What I think is the most efficient and effective way, what I prefer to do is send patients a prescription, or you can order it yourself from a website called FullScript. The reason I use this website is because all of the supplements when they're third-party lab tested. That means they are what they say they are, because they had another lab test to make sure that was the case. You could also use your FSA or HSA to purchase it. It's not that expensive, about $20 per month supply. And sometimes you can get it even cheaper. The last option, which I don't recommend, is buying something just over the counter at CVS or Walmart or Target. The reason why I don't typically recommend that is because there's been studies where most of those brands aren't what they say they are. The FDA doesn't regulate supplements. So if there's no third-party lab testing, they don't have to sell you what they say is on the bottle. So this was an article in ABC News where they look at brands like Nature Made and GNC, and they either found that what was in them was much less than what the bottle said. Also, some brands like Nature Made put soybean oil in their supplements, which can be very inflammatory and also mimic estrogen in our body. So things I would avoid over the counter. My preference is full script, but you could also go to full script, find the brands, and order them from Amazon. That would work too. Okay, so finally, we're going to get to fibroids and vitamin D. So we know that women with a lower vitamin D are higher risk for having fibroids. More prevalently, they have fibroids. Vitamin D does play a role in tumor growth and fibroid growth. So I'll talk a little bit about that. So as I mentioned before, fibroids have a role in preventing blood vessels from growing excessively in cancers. And the same concept is believed to be true with fibroids. It also has an anti-tumor effect. So it slows the growth of the tumor, also improves your immune system and your sex hormones like estrogen. So for these reasons, the studies have found that women who take vitamin D see a decrease in their growth of their fibroids. Now, I have seen women who have a normal optimal vitamin D level and they still have fibroids. So again, this goes back to, it's not necessarily a cause and effect. If you don't have enough vitamin D, it doesn't mean you'll have fibroids. And sometimes you can have plenty of vitamin D and you still have fibroids. So again, we need more research in this area. As I mentioned, women weren't included in studies till 1993. So we have a lot of room or a lot of things to catch up on. Some of these studies were animal studies. There's not been a ton of human studies. So that is, a brief overview of what we have found with fibroids and vitamin D. There have been a few studies where their headlines say, taking vitamin D shrinks fibroids. I have looked closely at these studies because, when I first read it, if that's true, let me dig into this. Could we really fix everything with vitamin D? And unfortunately, that wasn't the case. So most of the time, the change in size of the fibroid was by a few millimeters. So that's smaller than the width of your fingertip. So if you have a fibroid this big and it shrinks this much, you're not going to be able to tell a big difference. Also, depending on where the fibroid is, even if it shrinks a little bit, it might not improve your bleeding, might not improve your fertility, or your symptoms of pressure and things like that. So although we check vitamin D, we want to make sure vitamin D is on board for our patients who are deficient. It can help the fibroids from growing as rapidly. It won't necessarily shrink them down. So let's talk about treatment options for fibroids. You have medical management. So typically that is birth controls, oral contraceptives, or oral hormones. Most of the time, this just gives you relief from bleeding or pain. There's some medications that can put you in a menopause-like state. These are medications like Myfembree or Lissa that have been shown to slightly decrease the size of the fibroid and over time decrease your bleeding. But again, they put you in a menopausal state. So not ideal if you're looking for a quick treatment option, or if you're looking, or if you're hoping for fertility. Surgical interventions, UFE or uterine fibroid embolization is one that I honestly see a lot of commercials about. However, I personally would never undergo a UFE. So a couple of reasons why. If I'm having such severe symptoms from fibroids that I need to have a procedure, I want a procedure that will take care of my symptoms quickly, that will increase my chances of fertility, and will be kind of like a one and done. UFE is not necessarily that. So when you have uterine fibroid embolization, their goal is to put this gel-like bead substance in the uterine arteries and the blood vessels that feed the fibroid. And then by blocking the blood supply, they're kind of starving the fibroid. The fibroid slowly dies and degenerates. Now, if your fibroid's this big, it may take a year to get smaller. That's a lot of time. If your fibroid is in the cavity, it's still gonna negatively impact your fertility. There is also a 20 to 37% chance that UFE can affect your ovarian reserve, so your ovarian health. It is not FDA approved or approved for fertility treatments or to help someone get pregnant. So for those reasons, it's not my first line choice. Other options, you have an open or robotic myomectomy or open or robotic hysterectomy. So what a myomectomy means is going in and taking out the fibroids. Open surgery means you have an incision about this big along your bikini line, and that's similar to a C-section. That typically has a very long recovery, 6 to 8 weeks. A big incision, you're in the hospital longer, higher rates of bleeding. And really the recovery to me is something that would be hard to deal with. Taking 6 to 8 weeks off work, or taking care of your family, or just life. that would be hard. Open or robotic hysterectomy is another option. So typically removing the top of the uterus to also remove the fibroids too. Robots are a newer option in the last 5 or 10 years. A robot, it's important if you have a robotic surgery to ask the surgeon how many incisions, how big the incisions, because that varies. A lot of times with a robot incision, you have at least 5. With a robot surgery, you have at least 5 incisions. And sometimes they'll do those 5 incisions and then they still have to make a big incision to take the fibroids out. So it's an option that I would have many questions about if someone wanted to do a robot surgery on me. Now we have our minimally invasive procedures that we do here at the Center for Innovative GYN Care. These, in my opinion, are the best option for having your fibroids removed. Surgery is typically about an hour long. I'll get into that a little bit more. You have a much faster recovery, much less incision, or much smaller incision sizes and less incisions than a robot. We also, with our approach, can feel around the uterus. So many times, and I have a picture of this later, many times the ultrasound might be wrong, where they say you have 3 fibroids and we take out 10. Or, we've even had someone said they had 6 fibroids and we took out 42. So it's really important to see a specialist when you're having surgery so that they can pivot and adjust if they need to, if your imaging is slightly off. Now, I don't say that you shouldn't, if you had an ultrasound that said you have a few fibroids, typically it's pretty aligned. So don't panic that your imaging's wrong or something like that. alternatives and complementary approaches. So a lot of these alternative and complementary approaches, I'll mention a few of them. Green tea has been shown to help slightly reduce fibroid size, about the same as vitamin D. Serrapeptase enzyme can be another one. Drinking less alcohol, being very active, having a healthier lifestyle. So all these things support you in your journey with fibroids, but most of the time, well, I would say all of the time, they're not going to drastically shrink your fibroids. They're not going to give you immediate relief, and they are not going to necessarily increase your chances of fertility if you're having problems with infertility. So I'll talk a little bit about our LAM procedure. That is a minimally invasive myomectomy procedure that we do here. We use 2 incision sites, one tiny one in your belly button about the width of your fingertip, and one in your bikini line that's about 4 centimeters wide. So in that 4 centimeter incision, we're able to take out all fibroids, no matter the size, even the size of a watermelon. We're able to take them out of that small of an incision. We also can look for other fibroids that your ultrasound may have missed. The ones that are most important if you're trying for fertility are fibroids in your cavity. We want to make sure that none are missed there. Those incisions are closed with stitches typically, and you have very fast recovery time. Let's talk about, how long you're under surgery. With our LAM procedure, it's typically an hour to 90 minutes. It depends on the size and number of fibroids. With a robotic procedure, you can see that is a much longer procedure, open even longer. This is important because that's time under anesthesia. That's time in surgery. And typically longer time under anesthesia increases your risk for things like blood clots and things like that. Hospital stay. Here at the Center for Innovative GYN Care, we are an ambulatory surgical center. So we are not in a hospital, which gives us and our patients the ability to go home the same day. They have a faster recovery time, typically, 7 to 14 days. It depends on the size and the number of fibroids, versus an open surgery recovery is about 8 weeks. We also, are able to remove a lot more fibroids than a robotic surgery. As you can see here, a study we did, on average, a max number of fibroids removed, we had a case where we removed 103 fibroids, whereas a robot case, the max removed was 13. Open, more 65, but then you have a much longer recovery. So what we're able to do here at the Center for Innovative GYN Care is take on patients who were told you can only have open surgery, we can't do it any other way, and we're able to perform their surgeries with less incisions, less downtime, a faster recovery, and they go home the same day. So this is kind of a graphic picture, but this is a real life story of one of our patients. This patient traveled to us from Atlanta, Georgia. You can see she suffered from a very large fibroid for many, many years. She was mistaken for being pregnant often, which took an emotional toll on her, as you could imagine. Clothes didn't fit her well. She had very heavy bleeding, and she was told she could only have an open surgery with a very large incision, possibly blood transfusion, and a long recovery time. She came to us. She had her surgery, went to a local hotel that night, and flew home in a couple of days. So she had a very successful surgery. You can see, the immediate difference in her abdomen, immediate relief of symptoms, and you wouldn't get that with something like UFE or embolization. So this is another picture. This was a patient who her ultrasound said she had 3 fibroids, and as you can tell, we took out many more than 3. And we took them all out of that small incision again. Some of these are cut in half, and that's because we have a technique where we kind of cut the fibroid down to get them out of that small incision. So if you are preparing to have a surgery, It's important that you read all the post-op and pre-op instructions. We give a lot of instructions out via email. We also have a nurse that calls to prepare the patient. But also it's important to write any questions you have down. We welcome any questions before surgery, during your pre-op call. If you have more questions come up, we often have patients call and we're able to answer those for them. Do some research and advocate for yourself. I personally think it would be worth it to travel for surgery if you're not local. We have a travel program, but I would rather have surgery from a specialist versus someone local who maybe who does 2 or 3 surgeries a year. Diet and nutrition can be really important before and after surgery, especially like eating enough protein after surgery can be very supportive. Having vitamin D rich foods before and after surgery. Those are typically very nutritious foods too. And then having assistance and support. So taking time off after work, resting, the more you can rest initially after surgery, the faster your recovery will be. And just having some support, our emotional and physical support, having someone maybe bringing meals can be really great after any surgery.
Hey, Emily, before we move on, if we can just quickly address some of the questions that have come up so far. We could start with Storm's question. It's in the Q&A if you see it.
Okay. Let's see.
This may seem elementary, but do you see it? If you are having a regular cycle, why do fibroids make, quote unquote, the bleeding heavier? Yet the fibroids are fed from the blood supply. Is that the blood supply of our body in general or the direct blood supply from the cycle?
Yeah, so that is a blood supply from the uterus. So the fibroids has vessels from the uterus that feeds the fibroid. And then those fibroids can cause heavier bleeding.
And then we have another one from Elizabeth. Will vitamin B supplements from age 14 onward help to control fibroid growth?
From the research I've seen, yes, it will. But it's important to check what the levels are for anyone. So often they check babies' levels, they check infants' levels, toddlers, teenagers. So you can check vitamin D levels at any age. In my opinion, the earlier the better. And to get that optimal level going earlier is going to be more beneficial. Again, it's not a direct cause and effect. So if you perfectly supplement with vitamin D, does that mean that you won't get fibroids? Not necessarily, because there's a lot of other factors that are involved. But from our research, it seems that vitamin D supplementation would be very beneficial to preventing fibroids from growing as fast or as big.
And we'll take one more and then we'll leave the rest for the end. But what is the recommended daily dosage of vitamin D to maintain appropriate level if you have fibroids?
So again, the optimal vitamin D level is between 60 and 80. And that is optimal for overall health, also for women who have fibroids. Now, dosage is dependent on what your level is. The typical recommendation is between 4,000 and 5,000 international units a day. I have had some patients who need more than that. And I know that because we start them on vitamin D and we retest 3 months later, we check the level, see how fast it's gotten there. Some patients might need less than that. Some people absorb it really well. So again, it's really important to monitor your level to know if you're taking enough or if you're taking too much, or if you need to adjust the dosage at all.
One more.
Yeah, go for it.
How soon after the LAM procedure can one try to get pregnant? I have been told 6 months to give the uterus time to heal.
So it depends on where the fibroids are located. Here at the Center for Invasive GYN Care, we take a very personalized approach to recommending when pregnancy is okay, and it really depends on where the fibroids are located. If it's a pedunculated fibroid that's not really affecting the muscle, of the uterus, then you could get pregnant pretty quickly after. But if it's in the muscle at all, involving the muscle, the typical recommendation is 3 to 6 months. The reason why is during the surgery, we are making cuts in the uterine muscle to take out the fibroid. That same uterine muscle is what stretches when you have a baby. And then when you go into labor, it's contracting. So it puts a lot of stress on that muscle. And if you had cuts in that muscle that didn't heal fully, you can have holes, for lack of a better word, develop in the uterine muscle in labor, which would put you and the baby at risk for your uterus coming apart some. So that is a big reason why we recommend waiting 3 to 6 months to get pregnant. Again, here we take a more personalized approach to tell a patient specifically how long they should wait. But if you were told 6 months, that is not unreasonable. Sometimes it can be less, but waiting is really important to make sure you have a healthy pregnancy.
Great. So I think we're gonna go a little bit over the time because I see a lot of questions coming in. We're gonna try to address them, so we'll stay on for a bit longer. If you have to jump off or at exactly a 1, we'll share the recording afterwards. I'm also gonna encourage you to please complete the evaluation form, which I will share in the chat box as well as in the email. So Emily, you can continue with your presentation.
So I actually only have one more slide.
Okay, great.
So it basically is just about our lamb surgery and recovery, which we already covered here at the Center for Innovative GYN Care. Again, we do it in a surgery center, not in a hospital. Typically faster recovery. It depends on how big your fibroids are and how much we find. When we get in there, if your fibroids are greater than 20 centimeters, then you're going to have a longer recovery because there's just a lot of changes going on in your body after surgery. But again, in less than an hour, we're able to remove all those fibroids, symptoms go away, recovery is much faster. You don't have to take as much narcotics, and then you can return to your work and life and daily activities much faster. I love hearing stories from women who had a patient 2 weeks ago who her husband commented that she can finally, run a marathon and be a lot more active, goal she was always had now that she had surgery because she doesn't have that pressure of the fibroids. We had a patient from Australia who traveled to us who was told she could never get pregnant because of her fibroids. She had to have a hysterectomy. And we were actually able to remove her fibroids and she got pregnant, and she's had other pregnancies since then, and she was able to carry. One thing that's important to mention that I haven't mentioned yet is it's important to take care of your fibroids sooner rather than later. Fibroids can and will continue to grow. Sometimes even with vitamin D supplementation, that can happen. And so if you have fibroids, it's important to monitor them. So you can have your practitioner order ultrasounds every 3 to 6 months to make sure they're not getting bigger. If they are getting too big, you run into the risk of the fibroids kind of taking over your uterus, your uterine muscle, taking over your uterus to where there's not much healthy tissue left. It's all fibroids. And so we don't want that. When that happens, it really decreases your chances of having pregnancy if that's your goal. And we might even recommend that you don't get pregnant because there's so much damage from the fibroids to your uterus that we would recommend, using a surrogate or using other options because the risk would be too high of having a pregnancy and carrying it safely to term for both you and baby. So again, treatment earlier, sooner rather than later is best. Having an ideal vitamin D is going to help to slow down the fibroid growth, but it's not an all-out treatment, but it can help. And it's important, if you do have fibroids, to look for treatment sooner rather than later, and especially treatment from a specialist, someone that does this surgery every day like we do. That's not as common. Some surgeons only do it once a month. So it's important to find a surgeon who can take care of your needs. It's a bonus that we also specialize in endometriosis. A lot of times we find endometriosis in patients who came to us only for fibroids. Endometriosis can cause pelvic pain, can cause infertility. We take that out at the same time we take out your fibroids. So those are just some of the options that you have. I hope that was informative, and we'll jump to questions.
That was great. Thank you so much, Emily. And I think right now we'll go ahead and start addressing the questions we weren't able to do so earlier. And if you have any right now, any questions, we're going to allocate the next 5 minutes to kind of address those. And like I said, please, before you leave, go ahead and complete that evaluation. And I'll be also sure to send you all resources shared today, including the research that Emily talked about, and links to where to purchase your vitamin Ds as well, in my follow-up. So
I can read some of the
okay,
questions.
great.
So one of the questions is LAM a proprietary term for CIGC? And the answer is yes. So our surgeons here developed the LAM, which is laparoscopic assisted abdominal myomectomy. What that means is we use a laparoscopic approach and a mini laparotomy, which is technically an open approach with a very small incision, to remove fibroids. This procedure is not done elsewhere, and it is proprietary to us. There are some different techniques out there, but that's what we do here. The next question is, what's the recommended daily dose of vitamin D3? I kind of already touched on this. It really depends on your level. Typical recommendation is between 4,000 and 5,000 IUs per day. Some patients do well just 2,000 IU. Again, it really depends on your number. If you start a vitamin D supplement, it's important to recheck your level to make sure you're not taking too much, or that what you're taking is working. The next question, we answered this: how soon after a LAM can you get pregnant? Really depends on the patient and where the fibroids are. Average, though, would be 3 to 6 months. Let's see. Is there a way to naturally reduce the number or size of fibroids without surgery? So again, there is some research emerging that vitamin D can stop the growth of fibroids or slow it down. But I have not seen any research saying the fibroids will disappear or go away. And if your fibroid is, the size of a cantaloupe, if it shrinks just a little bit, it's not going to help your symptoms. It might not help your bleeding. It also might not help your chances of fertility if you're having issues with infertility. Let's see. What's the minimum hemoglobin level a patient should have before undergoing LAM procedure? So it depends on the patient. I know we don't all love answers that say it depends, but many times in medicine, it depends. So it depends on the number, size, location of fibroids. These things will influence how much a patient typically will bleed. Because our doctors have been doing this for many, many, many years, we have a good idea of, or a good understanding of, where a fibroid is, might increase a chance of bleeding or decrease. So if a patient only has a pedunculated fibroid, chances of bleeding are much less. But if a patient has 10 plus fibroids and they're all in the muscle, they're going to have a higher risk of bleeding. We have many techniques in our surgery to reduce the risk of bleeding. Our typical blood loss is, around 200, I believe, for fibroids, and that is an anecdotal number, not from our research. But typically, it's not a lot. It's about the same as someone's really heavy period. So again, we don't have a minimum number for hemoglobin. It depends on the size, location, and what type of fibroids you have, and we take it on a case-by-case basis. For just general knowledge, a normal hemoglobin is between 12 and 14. We often have patients who are around the 10 mark and do fine with a LAM. But again, it depends on the size. So if it's really big, we might want you to be higher just so you have an easier recovery. See. Oh, it looks like someone's having issues with the evaluation link.
I just sent a new one. If you're try to copy and paste if you're having sometimes if you're not on Chrome, it does create a bit of an issue. So try to copy and paste it into your browser. If you're still having an issue, I'll be sure to send a new link via email, but it should work now. Thank you. We have a question about ablation in the
Yeah.
Q&A, Emily.
Oh, okay. I don't have the Q&A up. So
Oh, it says, what about
that.
surgical endometrial ablation?
Okay, so endometrial ablation is where a surgeon will go into the uterine cavity and they will burn the inside of the cavity or ablate the cavity, so the cavity is where your uterine lining is. Your uterine lining is what builds every month and then sheds, and that's what gives you your period. So ablation is just burning of that cavity. Most of the time it leaves it scarred so it doesn't rebuild. Sometimes this can be helpful in patients with abnormal uterine bleeding, sometimes with polyps, but not typically with fibroids or if someone has adenomyosis, which can be another cause of bleeding. We often see patients who have adenomyosis or fibroids in the cavity. They had ablation and their bleeding didn't go away. So then they're with us to get complete relief of their symptoms. Then there's a question about over-the-counter vitamin D with safflower and sunflower oils and vegetable glycerin. Is that okay and safe to have in an over-the-counter supplement? I would say typically yes. The one I recommend has olive oil in it. There's some people that will say that sunflower oils can be inflammatory. I've also heard that they're not. So I would be perfectly fine taking a vitamin D supplement with safflower and sunflower oils or vegetable glycerin. If you can find one without, great. If not, then I would stick with what you have. Also on that note, if you have a vitamin D supplement at home, I would finish what you have before you buy something new. Just save some money. Even if it's D2, even if it's not well absorbed, finish what you have before you buy something new. It's not, in my opinion, it's not worth, things are expensive nowadays. So use what you have first and then go from there. I don't typically recommend gummy vitamins because you have to chew a lot to get the absorption of those. They do make liquid vitamin D if you can't take pills. There was a question, I think I missed, about EGCG. So what this is it's a green tea catechin. So it's in green tea. There is some research about green tea helping to slow down the growth of fibroids. But again, similar to vitamin D, it's more of an adjunct therapy versus a treatment.
Thank you all for your patience. I think we figured out the evaluation issue. Did we address all the questions, Emily?
Let me go through one more time. Oops.
Oh, is lamb used for hysterectomy or only fibroid removal?
So our hysterectomy technique is called dual port. So it's similar to our myomectomy technique where we have one port or one incision in the belly button the size of your fingertip, and then a 3 or 4 centimeter incision on your bikini line to take out the uterus. We have taken out a uterus, as big as a watermelon, uterus that goes up to someone's chest bone. We're able to take those out in those small incisions. You can also, and that's if you leave your cervix, you have the option to take your cervix out, which would be smaller incisions on top. But that's a different talk for a different day. But it's a similar technique for hysterectomy is the short answer.
So we'll take one more before we wrap up. We are a little bit over our allocated time, but so last question you see from Lisa.
Yes. So gummy vitamins. So the other issue with gummy vitamins is we don't necessarily know how much you're getting, because there are no studies that show like a patient took 1,000 IUs of this gummy vitamin and they were able to completely digest it and absorb it all. So again, the question kind of is not just with chewing, but also with absorption and how much vitamin D they're able to get in that one gummy.
Great, thank you so much, Emily. And I want to thank you all for being super interactive and bringing on your questions. This is definitely specifically towards addressing, again, fibroids, treatment options, and then its connection to vitamin D. But we also have another webinar scheduled for next month, which would particularly focus on endometriosis and its like relationship to mental health, but then also some effective treatment options. Another thing that Emily just talked about is that treatment options that we specialize in, which are LAM and the dual portal method for hysterectomy. LAM is specifically, like she mentioned, used for fibroid removal. And we have a whole entire 1 hours webinar that's dedicated to talking about those techniques as well, which is presented by Dr. Denoyans. And so be on the lookout to for these webinars, which we usually send notifications ahead of time. So if you're not part of our mailing list, please do let me know or send me an email, and I'll be sure to include you in our mailing list. You have been such a joy to have today. It's such an interactive group, and we hope we were able to address all your questions. If you have anything that we weren't able to address during our webinar, please go ahead and send me an email, and Emily or one of our specialists here would be able to address your questions, and I'll send you a response. And sometimes we're very active on our social media accounts, so we'll be able to address these questions on our social media accounts as well. I do encourage you to complete the evaluation form. It really does help us improve our programs. It also helps our speakers really understand where to improve and where we did well. So you can also indicate what kind of topics you're interested in hearing about in that evaluation form. It shouldn't take more than a minute or two. So please go ahead and complete that. And like I said, all resources would be shared with you in the follow-up end of today or by the end of the week. All of our past recordings of Ask the Expert series are also available on our YouTube channel. Thank you so much for being here with us. And thank you specifically, Emily, for this wonderful presentation. And we hope to have you back doing this webinar soon.
Yeah, thank you. It was
Thank
fun
you.
to do my first one. So please provide any feedback. I am open. If I nerded out too much on you, or if you needed more information or too much somewhere, please give me all the feedback. I'd love to hear. If you have any questions, reach out to us on social media. We'll try to get all those answered to help. If you have a question, someone else probably has that question too. So we're happy to answer.
Absolutely. Okay, I'll stay on for another minute or so. Please feel free, Emily, to jump off and head to go do your thing. And I'll just stay on just to make sure that you know, if you are completing the evaluation form, you don't lose the link. Thank you, Emily.
Yeah, thank you.
Oh, yes, absolutely. I can share our link. It's usually, it should be CIGC. And also our TikTok account also has, it's under CIGC. Let me quickly share that with you, our handles. All right, here's the Facebook account. All right, thank you all so much. I'm gonna go ahead and end this webinar now. Have a good day.